Hi, I'm Professor Fit RN, and in this quick short, I am going to inform you of 6 things that you can do to help yourself have a very smooth transition into nursing school. So let's get started. The first thing you can do is make sure that you have a drawer full of white socks. And you may say, white socks? Well, it depends on how strict your school is with the dress code. You do not want to get sent home because you have on white and pink socks or either red socks because you're in a hurry and you cannot find white socks. So just be on the safe side, go ahead and buy a lot of socks and keep them in a sock drawer where all of them are white. And while we're talking about the feet, you may want to go ahead and buy yourself some compression socks. If you have a really good fundamentals nursing instructor, she will inform you of how when nurses are on their feet for a very long time, it can lead to very painful legs. So you want to try to prevent that. It can also cause some swelling in the legs. You can get these compression socks from the uniform store in your neighborhood, or you can order them online. But the reason why I say to get some compression socks is because when you go to clinicals, you may be doing clinicals at a hospital site that doesn't have a lot of chairs on the floor. That has happened to me once. So that will lead to you, the student, standing on their feet for the whole 12 hours because, of course, the staff is going to have first come, first serve to those chairs. You will be standing and your legs may begin to hurt. So it would not hurt to go ahead and purchase at least one pair of compression socks. The third thing you can do is make sure you have your support system organized. And I say this particularly if you have children. If you have children, you need to have more than one babysitter. I strongly suggest that you have at least 3 babysitters. And the reason why I say this is because nursing school is different from any other just regular college program or college course. You have a student handbook that you will have to follow, and they have rules. And they don't like for you to be absent, okay? So out of all the schools that I have ever worked at, I have never seen grandma is sick as an excusable absence. So what that means is that if your babysitter gets sick, you need to have at least 2 other people that you can count on, because depending on what school you are going to, that is most likely not going to be excusable. 4th, continuing on with support system, in case anything happens to your car, and if you only have one car, it would be ideal to have at least 2 other people that you can count on to get you to and from school and to and from clinicals. Help yourself before the program begins and get organized. Have your support system together. The 5th thing you can do, and this will help you through your journey of nursing school and also throughout your career as a nurse, is to get organized with your immunizations, your TB skin test, and your CPR certification. Keep those things in a folder. If you have them in your email, keep them in a part of a special folder in your email, because you will need those things. If you know that you've gotten into nursing school, you may want to just go ahead and get a TB skin test. You may want to go ahead and get certified for CPR, because you will need those things to get cleared to go to clinical, and you do not want anything keeping you from starting clinical on time. Those are things that you're going to need. And the very last thing that you can do is just to prepare yourself to actually read your student handbook. And I say this because if you don't know anyone who's gone through nursing school, you are going to have to actually read your student handbook throughout the nursing journey. It is a guide because it is so different. So usually when people give us things to sign, we're like, oh, okay, we're just going to sign it. That's a lot of words. You actually don't want to do that with your student handbook. You want to know what is in that student handbook. There's very valuable information regarding what happens if you miss X number of clinicals? What happens if you miss X number of classes on campus? What happens if you don't contact or communicate with your instructor? What absences are excused? Which ones are not? How do you pass the class? What is the grading scale? Because the grading scale will change. It's different from your English comp class. The grading scale is different in nursing school. All of that valuable information is in the student handbook. What happens if you fail a course? Can you continue? Can you come back to the program? All of that is in there. And you need to know that right at the beginning of nursing school. You need to know what it takes to pass the program, and you need to know what it takes to fail the program. Don't forget to subscribe, like, and share.